Hi, I'm Garvin. This video is about Alzheimer's disease. So Alzheimer's disease is the most common cause of dementia. The symptoms might include language difficulty, loss of recent memory, or poor judgment. In other words, loss of intellectual and social abilities severe enough to interfere in daily life. Although there is no cure, treatments may improve the quality of life for people with Alzheimer's disease. Those with Alzheimer's, as well as those who care for them, need support and affection from friends and family to cope. So the signs and symptoms of Alzheimer's disease may start with slight memory loss and confusion, but eventually leads to irreversible mental impairment that destroys a person's ability to remember, reason, learn and imagine. We all forget where we put our car keys, or get a blank on the names of people whom we rarely see. But the memory problems associated with Alzheimer's disease persist and worsen. People with Alzheimer's may repeat things often, they forget conversations or appointments, they routinely misplace things, often putting them in strange locations, eventually forget the names of family members and everyday objects, have problems with abstract thinking like balancing a checkbook, show difficulty in finding the right word or follow conversations, lose sense of time and date, have problems completing everyday tasks such as knowing what to do if food in the cooker is burning, show changes in personality such as mood swings, distrust in others, increased stubbornness, social withdrawal, depression, anxiety, aggressiveness, they hoard items and commonly money or coins. For diagnosis, doctors can accurately diagnose 90% of Alzheimer's cases. The most common form of diagnosis is a test which is made up of a series of questions designed to assess thinking and memory skills. It's called the Falstein Mini Mental State Exam. This is also used to track progression of the disease. So the causes of Alzheimer's. We can't really blame any one factor for Alzheimer's disease. Instead, scientists believe that it may take a combination of genetic, lifestyle and environmental factors to trigger the onset of symptoms. The risk factors. Alzheimer's is a complex disease likely caused by a number of factors, such as infection or reduced circulation and genetics. Although all the contributing factors may never be known, scientists have identified several common risk factors. These include age. Alzheimer's usually affects people older than 65 years of age. Heredity. Your risk of developing Alzheimer's appears to be slightly higher if a first-degree relative, like a parent, a sister or brother, has the disease. Sex. Women are more likely to develop than men. Mild cognitive impairment. Many people who have mild cognitive impairment, i.e. have existing memory problems. And lifestyle. The same factors that put you at risk of heart disease may also increase the likelihood that you'll develop Alzheimer's disease. So complications in advanced Alzheimer's disease, people may lose all ability to care for themselves. This can make them more prone to additional health problems such as pneumonia, difficulty swallowing food and liquids, may cause people with Alzheimer's to inhale some of what they eat and drink into their airways and lungs, which can lead to pneumonia infections. Urinary incontinence may require replacement of a urinary catheter, which increases the risk of urinary tract infections. Injuries from falls. People with Alzheimer's may become disorientated, increasing the risk of falls. Falls can lead to fractures. In addition, falls are a common cause of serious head injuries, such as bleeding in the brain. So, for disease progression, Alzheimer's disease typically develops slowly and causes a gradual decline in cognitive abilities. usually over a span of 7 to 10 years. It eventually affects nearly all brain functions, including memory, movement, language, behaviour, judgment, and abstract reasoning. While each individual is different, the progression of his or her disease can be roughly divided into 3 stages: mild, moderate, and severe. So for mild Alzheimer's disease, memory loss, lapses of judgment, and subtle changes in personality, decreased attention span, and less motivation to complete tasks, resist change and new challenges, and get lost even in familiar places. They may substitute or make up words that sound like or mean something like the forgotten word. They sometimes even avoid talking to keep from making mistakes and appear subdued or withdrawn, especially in socially or mentally challenging situations. They may also put things in very odd places. For example, a wallet may end up in the freezer, or clothes may go into the dishwasher. They may ask repetitive questions or hoarding things of no value. When frustrated or tired, they may become uncharacteristically angry. Moderate Alzheimer's disease. So they can't organise thoughts or follow logical explanations. They lose the ability to follow written instructions and often need help choosing proper clothing for the season or occasion. Eventually they require help getting dressed because their confusion may cause them to put their pyjamas on over their daytime clothes. They may also have episodes of urinary or fecal incontinence. It's usually during this stage that people start having problems recognizing family members and friends. They may mix up identities, thinking a son is a brother or that a spouse is a stranger. They may become confused about where they are and what day, season, or even year it is. Because they lack judgment and tend to wander, people with moderate Alzheimer's disease aren't safe on their own. They may exhibit restless, repetitive movements in late afternoon or continually repeat certain stories, words, or motions, such as tearing tissues. Problems with communication worsen during moderate stage of Alzheimer's. This can lead to a variety of challenging behaviours, including paranoia that sometimes provokes accusations of infidelity or stealing, agitation, frustration or anger that can lead to cursing, kicking, hitting, biting, screaming or grabbing. So last is severe Alzheimer's disease. Requires help with all their daily needs. They lose the ability to walk without assistance and then the ability to sit up without support. They're usually incontinent and may no longer speak coherently, rarely recognize family members. Swallowing difficulties can cause choking and they may refuse to eat. So how long? The rate of progression varies widely among individuals. For some, severe dementia occurs within 5 years of diagnosis. For others, it can take more than a decade. On average, people with Alzheimer's live for 8 to 10 years after diagnosis. Most people with Alzheimer's don't die of the disease itself, but of pneumonia, a urinary tract infection, or complications from a fall. For more information on the daily challenges and information for the carer and their families, contact us through the website, email us, or call into the pharmacy, Lynch's Pharmacy in Broaddale in Douglas, up near Iberhill. Thank you for watching.